So we're going to do a lameness exam. We're going to go outside, we're going to trot him, we're going to flex him, and then we're going to take radiogram. Flexion. My fingers. That's no pain, that's just him being a horse. Now I'm having a little bit of difficulty. So just right there. Oh yeah. Look at this. This is decreased range of motion on the fetlock. So when we do an examination on the fetlock, we go right here, palpate the tendons, and then we do passive flexion. Passive flexion. And he has very little passive flexion. This is going to be a very interesting radiograph. Palpate his back. Right here we see he has a little bit of pain, a little bit of back pain right there. I'm not putting a lot of pressure, I'm just with my fingers, just applying a little bit of pressure, not a whole lot. And as a rule of thumb, I just put that much pressure, almost nothing. Then we go to the hind legs, and of course they're horses, right? They're gonna start moving and all that. So my hand is right here on the inside of the leg, and I'm gonna palpate the bones inside that leg. I'm gonna feel for any kind of pain. He will move the leg up if he has a lot of pain. That's not pain, that's just him being a horse, okay? Don't confuse. Then now I'm gonna pull here, I'm gonna feel for fluids. Any kind of extra fluid, extra inflammation, anywhere else. Now we go to the other side and we do the same thing. It's so easy, we do the same thing every day. So right here we're gonna palpate the neck muscles. I'm also feeling for bumps in the neck to see if there's arthritis or inflammation right here in the neck. Another thing that I do is I borrow his head and I slowly, without a lot of pressure, I turn his head. He should be able to touch the shoulder if it was 100% normal. Right now, he's having a little bit of difficulty. Super sweet horse, right? But having a little bit of difficulty coming all the way. Then I go down, I feel the knees, I feel the bone, both inside and outside, and I can see, come on the inside, I can see that there's a bump over here. Right there, there's a bump. So a lot of times, we look with our fingers. Our fingers is the most important thing on the physical examination. Now I'm feeling the pastern area. Now I'm gonna pick up the leg, okay? And I'm going to do the exact same thing I did on the other side. Feel the tendons, feel the ligament, and he had decrease of range of motion right here. It should be flexing. This is gonna be a very interesting radiograph. I'm pressing right here in the sesame bones. I'm pressing right here in the pastern area. There's a lot of thickening going on all over, a lot of thickening. And now, to finish the exam, the same. We apply pressure, just with my fingertips, just a little bit of pressure. We can see that he does not like that. Woo-hoo. He does not like any pressure. Another thing that I do is I do mobility of the back. So I see where if he has restriction in the back. Oh, he definitely does have some restriction in the back. Woo-hoo. And I do a little butt scratch. See how it reacts? It's good again because it's fun. Butt scratch. Yeah. Then I feel for joint fluid in the stifle. This is the hock. Palpate the cannon bone, palpate the fetlock, palpate the pastern, and then go. Woo-hoo! Being a horse, right? That's the important thing of staying away from where they kick. Horses do kick, but if you know that they're gonna kick back, they never kick this way. Safety. I'm gonna come here, I'm gonna palpate the bone in flexion, I'm gonna palpate the hock, and range of motion. And that's it for now. Physical exam completed.